sessions. So a couple of notes. Talked with some of our wonderful clients here today who gave me a couple of pointers. One is in the materials, in case you haven't figured this out yet. The materials have a written section and the PowerPoint. You can follow along on the PowerPoint in writing in the binder. They follow the written information. And also, I didn't say that Low, and Lynch has offices in San Francisco and in Monterey, and we handle cases all throughout California. I think we've probably had cases in every county, so we reach down from our Central Coast office as well as up to the border of Oregon with our San Francisco office. So willing to work wherever you need us to in California. So the next presentation is by Stephanie Krmpotic, one of our senior partners in the San Francisco office. I think 26 years? 28 in March, sorry. Stephanie is a very experienced trial attorney, and she put on this presentation actually for Parma earlier this year, and I was fortunate enough to attend Parma and heard her presentation, and it was very good. A lot of very important issues addressed there. It's on challenging damages in high exposure cases. Sometimes we get little cases. We don't need to do a lot of work to work them up, but when you have brain damage cases or quadriplegic matters, you have to handle them differently. And Stephanie's going to be talking about all of the important aspects to consider in those types of cases. And like I said, the presentation was excellent. Unfortunately, Dennis Timoney was unable to be here today as the moderator, but Stephanie is more than qualified to present on this topic all on her own. So thank you, Stephanie.
Thank you, Christine. Before I start, I want to say a few more words about Christine. She's been with our firm a number of years and is one of our very valued partners. You know, Low, and Lynch is now going on 70 years. And I would like to say this because of the people that I work with and their skill, that we've been able to be a firm and a presence in the state of California for all of those years. And I can't say enough about Christine and her abilities, not only in handling cases, but in also managing clients and developing relationships. So she's also the one who put on this seminar, put all this together, so I'd like everybody to give her an applause. You know, one of the consequences for having been around so long is that you tend to see everything. And there's, as you probably already know, almost anything can happen in these cases. So what I try to do is boil this down into categories. Now, this is not going to deal exclusively with every situation you might find, but hopefully there's some principles that you might find are valuable to you. So what I try to do is first deal with concepts, terminology, and one of the things that I think is most important, whether you're dealing with a construction defect case or a catastrophic injury case, is try to spot issues as soon as you can. The second part of this is going to be some tips on strategy, when to retain experts, what sort of information to pursue to determine if you have truly a catastrophic injury case with potential high exposure, or if you're really dealing with something else. And then lastly, with time allowing, I've got a couple of scenarios again from, I've got a long list of scenarios, but a couple that may help explain some of these concepts. And if you have any questions at all, you can either ask during this presentation, or you can ask me during the break or at some other time. There's as you might imagine, a great deal that we can cover in this topic. So what makes a case high exposure? And by the way, there is an outline in the materials. The PowerPoint doesn't travel along precisely with the outline. The intention was to give you some outline or some idea of the types of topics, questions that you should be asking if you're handling these types of cases. So what really makes a potential high exposure case is really the economic damages. That's where you have a potential future disability. and you're facing future medical costs, life care costs, disability that affects a plaintiff's ability to work, or assistance with activities of daily living. Now, how to recognize early what you're dealing with. I think it's probably somewhat intuitive and some common sense that tells you if you're dealing with a spinal cord or a head injury, you better be prepared to take it pretty seriously and gather information as quickly as you can to understand the severity. Injuries to children. Injuries to children are difficult. They can be difficult. Children can recover very quickly and have an amazing resilience, which is the good news. The bad news is they're highly sympathetic. There is not going to be any comparative fault, and you could face a potential of long-term disability and life care costs down the road. Types of accidents, transportation. I do a great deal of transportation work, and when big rigs hit small cars, bad things do tend to happen. Falls at elevation, construction site accidents, falling off of stairs, falling into swimming pools, falling off of roofs. Those are also the types of cases. Oh, I had the man that dropped off the zip line case once. That was, those cases tend to produce some very challenging injuries. So evaluating exposure early is very critical in my mind, because that's going to let you know if you need to retain experts early and just what type of effort you're going to put forward. Now, one of the things that I try to do, and I think this is also probably relevant to all of you, is you want to have an idea of what you're facing up front, and you're going to want to know what the budget is and how to target the efforts that your attorney is doing on any case. So that's why early identification can really help you. And with the attorney that you're working with, they can also help guide you as to what issues to really focus on. So the type of accident or incident giving rise to the claim injury is just going to tell you a lot just by virtue of what you're dealing with. And you can find in the collision report and initial treatment records whether or not you're dealing with a very serious injury. Another thing, who's the opposing attorney? I think we all know that there are, I call them the big heads, the plaintiff's attorneys that have only their names on the doors, versus someone who might be more interested in settling the case early, who may not really be prepared to invest the costs to handle a true higher exposure case. So my roadmap here, I just wanted to, I'm breaking this down roughly into three categories: traumatic brain injury, neck and back injuries, and other types of injuries presenting potential high exposure claims, and I'll explain a little bit why each of those, what is involved with each of these types of claims. So traumatic brain injury, one of the first things you need to look for is a manifestation of injury. That's critical. And brain injuries are usually going to manifest right away. It's typically not something where you're going to have somebody who says that they were injured but not present a brain injury until 2 months later. So that's kind of a red flag that you may not be dealing with a true brain injury. So a closed head injury, an open skull fracture, you're going to have potential loss of consciousness, loss of memory, focal neural deficits. You could have difficulty with feeling or sensation, alteration in mental state. Now, have any of you heard of a Glasgow Coma Score? Yeah. So a Glasgow Coma Score, a GCS, is something that they typically use, the first responders use, and that's going to be a very good indication if you're really dealing with a true head injury. It's on a scale up to 16, and if the score is a 16 at the place of, or the location of the accident or in the emergency room, you are probably not dealing with someone who's had a true or severe traumatic brain injury. It's possible, but the Glasgow Coma Score is a good indicator. Emergency room records are very important to me when I'm reviewing these situations. Now, subsequently, you can have a change in personality that can be affected, the cause of a traumatic brain injury. Problems with concentration. Someone tells you that they can't read or they're having difficulty with focus at work. Sensory deficits. You can have visual disturbance, double vision, loss of smell, alteration of taste, hearing. Tinnitus is a case I had recently of a rollover accident and a traumatic brain injury. The gentleman made a very, very good recovery, but he was so bothered by tinnitus that it was actually a legitimate aspect of his traumatic brain injury claim. but it is something that's more treatable. There are therapies to help with that. So here's an example. I'm going to go right into a scenario here of when you're getting some presentation or some report from a doctor and you're wondering, well, what does this mean? History. When he's reading a book, now this is the wife reporting this, when he's reading a book or something, he constantly has to go back because he's forgotten what he just read. His wife yells at him frequently because he's not remembering well. He states his wife is ready now to throw him out because she feels he does not listen. He is much more moody and he is depressed. He frequently starts fights with his wife. His wife would not come to the appointment with him today. So this is a case that I had involving a man who was reporting a head injury as well as a back injury. This is an excerpt from a medical record that I had received in one of my cases. So my first question to myself is, what else may be going on with this fellow? Is this a true traumatic brain injury case? Alternative causation is one of my favorite concepts as a litigator, looking for other reasons to explain what a plaintiff is presenting to you or what his or her attorney is alleging. So in this case, here's the explanation of what was reported by the wife. Opinion. The record also references issues of opioid dependency as well as possible abuse of narcotic medications requiring monitoring by subject's wife. In my opinion, the subject's records clearly indicate that the chronic pain syndrome pre-existed the subject accident. In my opinion, there is nothing in the medical records identifying any aggravation of the pre-existing chronic pain scenario. So, opioid addiction is a very common problem. This is just one doctor's opinion. So one of the things that I did is I made sure that I got all of the prior radiological reports. If those reports show you that someone has a structural issue with their back that is essentially the same before the accident or after the accident, and yet are claiming new and different onsets of pain, it's a good indication that you might want to look a little more carefully and consider some other factors before judging this person to be an eggshell plaintiff who had a true injury from your accident. Obtaining records is one of the most critical things that you can do in any of these cases, these injury cases, especially if you're dealing with something potentially high severity. And there are multiple reasons for that. You're going to want to look for someone that might have a drug or alcohol history, someone that may have a prior injury, someone that has social or family issues or other health issues. Traumatic brain injury can also be masking or a mask for other types of issues going on. It can be someone who's had trouble at work. It can be someone who has issues with their children or has going through a recent divorce or has other mental health issues such as depression. So there's a lot of other factors there, and you're going to find that out if you dig deeply enough. And so I always recommend in these cases to do those interrogatories or ask your attorney to do some discovery to find out, well, what is this person's job history? So some of the records that you can obtain are school records, work records. You can obtain prior medical records. Find out the locale of where some of these individuals lived, and you might want to, in the instance of Kaiser, you can direct discovery or subpoenas for Kaiser records in the local facility. Now, some plaintiffs' attorneys these days are really putting up objections and requiring that you do a protective order before they will allow an institution or a hospital or a medical facility like Kaiser to produce records. Kaiser will produce all the records for a particular individual. You'll get all of the records unless the plaintiff's attorney objects to the subpoena. Now, when we're dealing with some of the neck and back injuries, one of the most critical issues is, how is this impairing the person? How is it impacting their mobility? Because it's when you have impairment of mobility, that's when you start getting the future economic claims, because you have someone who may need future care, who may need assistance with mobility, but importantly, they may be claiming that they're not able to work anymore. So manifestations of injury, what do the films show you? I routinely, and I don't know that many plaintiffs' attorneys that do this, will retain a radiology expert to look at the scans, to look at the MRIs, to find out, is there really an injury? Or are we really dealing with someone who already had problems? I've had a number of cases also involving the Port of Oakland. if you have someone who's 60 years old and has worked in the labor field or in the construction field or as a longshoreman or something like that, the fact of the matter is they're probably already going to have some existing pathology in their backs, bad backs. I know I have a bad hip, I have a bad foot, I have a bad neck, so those aging process does, none of us have pristine bodies or pristine spine, backs, vertebrae, or spinal cords, or spinal issues. So the CT scans, MRIs, and X-rays are going to be a great indicator of whether we are dealing with a new injury or if you really are dealing with an old injury, because you can approach them very differently. Neurological involvement is also something that isn't as mysterious as it may seem. If someone truly does have a nerve impingement or a disc herniation or a bulge that's touching on some sort of a nerve root, the doctors are going to be able to tell you if a nerve root pattern makes sense for where that plaintiff identifies an injury to be. For example, if you have a herniation that's on the left side, you're not going to have numbness in the right foot. It just doesn't work that way. Obtaining information. I really enjoy this aspect of the practice. One of the first things that I try to do now is I ask my paralegal to do a social media search. And I just recently had a case involving a very severe accident, big rig versus a 23-year-old young man in a Mercedes. And we right away got his Twitter account, some of his Twitter feed, that talks a great deal about alcohol and solving every problem with 8 shots of tequila, things of that sort. Now, we don't know whether or not any alcohol was involved. We have a pretty good indication that this young man never applied his brakes and probably was going about 80 to 90 miles an hour at the time. But at least it's something to use for questioning during a deposition, and it may lead to other discovery. As it turns out, that Twitter account is now shut down. Identifying these issues early and jumping on this can give you so much information about what you're dealing with. I am a big advocate of getting all employment records. I also am a big advocate of looking for other health issues. There are a lot of other things that affect a person that may not see the light of day until you do discovery to find that out. Recreational activities. The reason I put that is that if someone tells you that they can't work, but then you find out that they took an 11-hour plane ride to fly to their vacation in Italy, it seems to me that they've got a pretty good endurance for long plane rides, and perhaps may not be suffering the pain that they're claiming. So looking for contrasts and contrasting information is very useful. Travel, criminal history, sub rosa surveillance. Because sub rosa surveillance is discoverable until you're 30 days before trial, I use this method very sparingly and only when I have a very clear indication that someone may not be truthful. And one of the strategies for sub rosa surveillance is to have your investigator go out and first do surveillance without actually filming the plaintiff. And if it looks as though they may have the opportunity to catch that plaintiff playing basketball or playing tennis or playing golf, then it may be a good idea to get that film. But I do recommend exercising some caution in how you do sub rosa surveillance. Now, the plaintiff themselves, witness credibility also is huge in how a jury may perceive your case. So sometimes I will want videotape. Sometimes I may not. But how your own witnesses or how a plaintiff presents at a deposition can make a big difference. And so, does anyone recognize who this is? Last year, Martin Shkreli, he's the fellow who bought the patent for an HIV drug to treat pregnant mothers, and the price went from $16 to $700. And this is when he's testifying in Congress, and he was later indicted for insider trading and securities fraud. Now, is that a smirk or is that a smirk? So, so injury scenarios. There are other types of injuries besides traumatic brain injury and spinal cord or back injuries that can create a potential risk of high exposure claims. the eggshell plaintiff. When you're dealing with the elderly or someone with diabetes, you may have to accept the fact that your accident may have caused greater injuries than you might otherwise expect. The last one, gunshot wounds, assault, or as the case that Lee brought up, the rape of that young woman. I've had a number of attorneys. Has anybody heard the term reptile theory? All right. So that's a very specific way that certain plaintiffs' attorneys will try cases to kind of expose or touch upon the vulnerabilities and fears that we feel the most. And when you're dealing with a victim of a crime, gunshots, rapes, or rape or injury to children, there are some special considerations that may create some additional sympathy for that plaintiff, and it is something that needs to be considered. Now, I'm going to wrap up here by just talking briefly about selection of experts. I think we're a little bit short on time for some, okay. So selection of experts is also can be a very useful tool if you pick the right experts at the right time. When I'm dealing with a traumatic brain injury, I think it's very important to get a neuropsychologist as opposed to a psychiatrist or a neurologist. Now, you may have a brain injury that is apparent on a CT scan, or you have it documented inside in the medical records with the first responders or in the emergency room after an incident that somebody has a subdural hematoma. Everybody gets a little frightened by hearing those terms. Neuropsychological testing involves just the cognitive functioning of an individual. And neuropsychological testing can also tease out malingering, secondary gain, psychosocial issues as well. So that's a particular type of a tool that I like to use, or expert that I like to use if I'm dealing with traumatic brain injury. Retain early. If you believe that you're dealing with a serious case and you've got a serious plaintiff's counsel, get the best expert you can find and retain them early if you know that you're going to use them, because the plaintiff's attorney may be seeking that same expert. You do want to be careful to opening up the door to other types of claims. For example, many plaintiff's attorneys may not recognize that they're actually dealing with a client who is depressed for some reason that they don't truly understand. They may be trying to make that into a different type of a case, like a back injury, or that really is a pain manifestation that's about something else. That something else may help you in reducing exposure, but it could also open the door. So that's something you want to have a thorough discussion with your attorney about. Now, challenging the opponent expert. I really do look thoroughly at what their background is and what their familiarity is with the condition. And item number 3, are opinions based on the case at issue or generalized opinions? Earlier this year, I had a case involving a 2-year-old that fell out of a window. The plaintiff's attorney hired an economist projecting wage loss claim down the road for this young man. Yes, I see you're looking. Yes, there were a lot of problems with this case and how it was being presented. As it turns out, the economist that he hired was so impressive. He was an MBA, he was a PhD, and he was 22 years old. But he'd only been deposed one time before. And I think the plaintiff's attorney didn't want to spend a lot of money. So as it turns out, this very brilliant, but guileless and inexperienced young expert told me a lot of really valuable things. It fits into category number 3. I got him to acknowledge that this report that he used was pretty much canned, that had been in existence for about 20 years. And what they did is they just cut and pasted some data based on the demographics of this particular young man to stick it into this report. I enjoyed that deposition. All right, selection of experts. There's so many that you can choose from. Selecting the right expert or junk science. Biomechanical experts, when you have some question about whether the dynamics or the mechanism of injury as reported are legitimate. For example, I had a case in which a woman was claiming a hyoid fracture. A hyoid bone is in the neck. And she was also a nurse and reported to another doctor that she had broken a bone in her neck, like a vertebrae, which was not correct. Did you know that the most common cause of a hyoid fracture is actually strangulation. So in any event, we didn't find her scenario particularly credible. You have medical experts, neuropsychological experts, psychiatrists can also be very valuable and important. Life care planners, getting the right life care planner is critical to being able to tease out whether or not a person of very modest income is actually getting a life care plan that shows a great deal of really enhancements in daily activity, activities of daily living and assistance. Medical billing experts can be very important in helping evaluate whether or not medical charges or future medical charges are important. As you know, in California, you're limited to the medical bills actually paid. Now, there's a couple of exceptions to that. But what you'll find with the experienced plaintiff's attorney is that they will get a life care planner that will project costs for medical treatment that may be exceeding what type of coverage that individual was getting for past medical for the injuries that they sustained. Now I'm just going to talk about a couple of my little case studies. And again, anybody have any questions so far you'd like to add? Yeah.
My question is that for the neuropsych, using the neuropsych for an examination, you have to either have a stipulation by the plaintiff's counsel, plaintiff, to do that, or you have to file a motion to do that, to be able to do the neuropsych exam, the mental exam under the code. What have you seen, if you have, courts doing with the granting of the motion?
I have had no problem getting court orders granting neuropsychological examination as long as you have all the elements there to it. And what you need is a declaration from the neuropsychologist setting forth what the tests are that they are going to perform.
Now, I've had some counsel say, well, we're going to limit our, under the code, we're limiting our psychological claim to the standard depression that one would experience due to being involved in this type of injury, and therefore you're not entitled to a neuropsych exam. Have you had that argument made to you?
I've had that argument made as well, and that may not be a situation where I'm going to want a neuropsychologist. You can also have a psychiatric evaluation, which can be very effective in providing information whether or not someone has is making a claim that exceeds what is the general psychiatric or psychological injury. But you were talking about motions in limine, and it's a very important one also that you can use to your advantage to limit a plaintiff's ability to get in evidence if they are taking a particular claim or cause of action off the table.
Thanks.
This is a case that was a very challenging one for me. This is an unbelted child who was in the rear seat with an inattentive mother who was looking for a cell phone, and it collided with a semi-truck, my client, making an illegal left turn on a frontage road. He suffered bilateral femur fractures, an open depressed skull fracture. His Glasgow coma score at the accident scene was 7, which means severe brain damage. He also, though, had a premature birth, a mother that had a drug and alcohol history, and he had documented developmental delays. This was an issue where going for the school records was critical. In California, if you have a child that's already in the special education system or special needs, they are required to undergo testing so that an individualized education plan can be developed. And as it turns out, we had a neuropsychological test a month before this accident. I will tell you that we were going to admit liability in this case because my driver of this semi-truck was a registered sex offender. So that's we did not want that to come out. Oh, by the way, my note on my in my binder here was settle early. One of the things that's very important, if you have a bad case, recognize it. Try to get that case settled early, because you may have an opportunity, especially if you're dealing with a plaintiff's attorney who wants the same thing. It can be very useful to you. So I'm just going to go over see one more of these scenarios. This one is a good example of how to address life care plans. This case involved a man who fell from a second story through an unfinished stairwell. It was a multi-contractor construction site in the South Bay. He suffered traumatic brain injury, clear, undocumented. You can see the list: bilateral traumatic subarachnoid hemorrhage, subfrontal contusion, interventricular hemorrhage, brain swelling. It was not so good. And he also had a T10-11 fracture resulting in paralysis. So he not only had a brain injury, but he was paralyzed. So he gets a diagnosis. This is what a diagnosis is going to look like from the DSM. It identifies just what you're looking at: T10 paraplegia, ASIA, ASIA. A is a category that defines the level of neurological deficits from the spinal cord injury. Encephalopathy means an actual notable difference in the brain tissue. So this is one where I had neuropsychological testing as well as a physical exam. But this we knew was a bad case. This might be a little bit difficult for you to read here, but let me just put it this way. The plaintiff was projecting a cost of $491,000, $290 that had to do with institutional care. So there is a big difference between someone who needs institutional care versus someone who is able to be in a home environment with a skilled nursing level of care versus someone who is able to be at home with just a home health care worker. And in this case, what was a critical issue in the case, and this was a $5 to $10 million difference in exposure, was whether he was safety aware, whether he knew if he could call 911, or if he knew if a stove was burning and could be safety aware, so that if he had just a home health care worker, he was not at risk of injury to himself. And importantly, at the deposition, he said he wanted to go home. And that was important to us, so we didn't look like bad guys advocating for a lower level of assistance for this man because of the severity of his injuries. Again, it's important to address these issues even if you had a bad case, because this was the difference between a $12 to $15 million case to a $20 to $25 million case. So I'm going to just end now by, again, offering you to come up to me and approach me with any questions you'd like. Obviously, there's a lot to this topic and how to strategize and deal with cases when you're dealing with high exposure. But I do think if you leave with anything here, the critical thing is try to identify early what you're really dealing with so you can come up with a game plan, whether it's to be proactive in retaining experts or be proactive in the questions you ask of the plaintiff's attorney to know what you're truly dealing with. Thank you.